And now, what exactly is it that you treat? You say, I am a physical therapist, I'm a chiropractor,
Right.
but what solution do you offer?
I'm a chiropractor, and I wish we could just go back to the story because the story was quite interesting. So, as I was working as a physical therapist, I realized that most patients were getting better, faster with chiropractic interventions because they'd come in from the chiropractor who was around Hurlingham that particular time and getting better results. So I decided to explore it. And so I took 30 days of leave just to go and explore and find out what chiropractic is all about. And she was very good. She actually invited me to her clinic, said, you can observe, but you know, you just can't practice this. You have to go to school and learn. So I had to leave. I resigned from Nairobi Hospital, went to the States and had to pursue my degree in chiropractic. And I came back in 2008.
Yeah. And was that such a huge investment, especially on your end? You're giving up something that's, you know, at the end of the day, I'm getting my paycheck. I have stability, I have a job, but now I've seen something new and I'd like to try it out. How huge was that risk for you?
It was huge. It was enormous. It really was enormous.
Yeah.
Just talking from the heart, I was, you know, kind of two-hearted, like, should I be doing this? Is it a good step? Because it's really 5 years of study. And as you said, you are in a comfort zone, you're being paid well. I was running the Nairobi Hospital Physiotherapy department when I left for chiropractic. So I really took a leap of faith to go into a different profession. But you know, there's a time in life when you know that, you know, it's time to move on, it's time to venture into something else. So it wasn't an easy step, but I forged on and I went in and studied.
Yeah.
Yeah.
Okay. So now let's talk about the solutions being offered, the services that you provide for people who come to see you.
Yeah, at the center, at physiotherapy, we offer holistic care in chiropractic, physiotherapy, hydrotherapy, therapeutic massages, yoga, you know, and exercises. Yeah.
Awesome.
So,
And when somebody comes to you, because different people have different things they have. Somebody has chronic pain, another person needs alignment. There's somebody who comes to you because they're pregnant and the difference in weight is just messing up with their whole body. So how do you tailor different remedies for different, you know, patients?
Yeah, we make sure that we are patient-centered and patient-focused. And that's the other thing that I realize in both private and public sectors, people, the doctors, the clinicians were not really patient-focused. They were not really looking at you as tabby. They're looking at you like, okay, she's coming with a back pain, so this is back pain patient, you know, not really this is tabby and what is she doing? How is she engaging in her everyday life? So at the center, we tend to understand the patients more. We tend to look at them as the individuals. So we are really tailor-making our treatments according to where they're coming from. It could be someone who sits for long hours in the office. It could be a cameraman who holds a lot of things and has pain in the shoulder. So you need to know that it's not just a normal pain. So if he goes back to his work, how is he going to adjust to that particular occupation that he has? So you need to be more centered, and that's where the disconnect was between the public, the private sector. They were not really analyzing the situation from a holistic perspective, like this is who you are, this is what the things that you engage in on a daily basis, and not going beyond just the treatment. You have to go a little bit more in detail to know what are the stresses that are impacting that particular person.
Yes, what is triggering your pain?
What's it
and
triggering
so
your pain?
Yeah. Awesome. And I really love that because I feel like it's usually a huge problem in the Kenyan health sector, where a doctor will just see you for the symptoms you've presented and not actually take time with you and find out exactly where is this coming from. You know, I could be having back pain, but it's a manifestation of something else. And you're just treating this back pain. So yeah, I do see the need for that more personalized forms of treatment. So now let's talk about the challenges now. You've quit your job, you've gone to pursue more education.
Right.
Now you've come back to the country.
Yes.
How was that experience? Did you feel the need to get back into employment, or did you now say, I want to start my own thing?
That's a very interesting question, because really, when I came back, I decided to test the waters a bit.